It is needless to say that it is very difficult to get a job as a nurse overseas. So today we're going to have a short conversation with a ICU manager working at tertiary hospital in Canada about what are the key factors to consider when you're getting a job, when you're applying for a job in Canada. So hello.
Hello.
Hello, hi. So thank you very much for your time today. Would you please introduce yourself just briefly?
Sure. My name is Chris Kutnick, and I am a manager of a tertiary care cardiac intensive care unit. And I've been doing that job for the last 2 years, and prior to that I've been a critical care nurse for probably 25 years.
That's great. So you've been in this nursing field for close to 30 years now.
Yes.
That's great. So just a quick question about the job, except like employment process per se. Because in Korea, when you apply for a job, sometimes the director of the hospital comes and then they interview the new grad nurses, or sometimes the head of the nursing department comes and they do have an interview with the new grads. However, how does it work in Canada? Are you actually the one who accepts the applicants?
So the international nursing process, I think, is a little more complex. And so as a manager, I probably don't have a lot of input into it, only because one of the things our human resources department would require to get a job would be a Canadian license. And so our human resources department, as well as myself, really don't have any input into how you apply for that Canadian license or that Manitoba nursing license. So that piece is done very much between the nurse and the College of Nurses in Manitoba. So when I get an application from a nurse that's international, has applied to my positions, one of the first things I do is when I look at their resume is look at whether or not they even have a Canadian address. Because if I see they don't have a Canadian address, I already know that I'm going to be forwarding that to our HR department to reach out to tell them how to navigate the system to get a license. So if I see they've had a license somewhere else on their resume, I might reach out and then see whether or not they've approached the College of Nurses in Manitoba to start that process.
So you're saying that because we're in Manitoba, and then if you're getting an application from any other provinces who already have license in any other provinces, it would be much easier to get the jobs in Manitoba.
Yes. Yeah.
Alrighty. So then my next question would be, let's make it easier, okay? Let's just say there's a person who is in Korea, already have a license for Manitoba. Let's say she has a Manitoba license.
Okay.
And let's say she applied for a job. What are the things that you first look at when you get the application? You told me about the addresses and everything.
Yeah.
Any other particular things that you look at in terms of skill-wise?
So, yes, I think one of the things that's really important is that your resume is very clear on your clinical skills and your abilities. So what might your experiences been? Are they caring for patients who have IVs, wounds, maybe other things like drains and tubes? Do you have a specialty in palliative? Whatever your specialty is, you want to outline. And again, it shouldn't have to be very long. It could be a very brief bullets of what your experiences are. The other thing that I look at on a resume is your work experience. And it should be laid out very clearly what those units might have been. So perhaps, and here's a good example, maybe you were working on a medicine unit, and you might put down your latest experience as November 15th of 2022 to present. And it might say inpatient medicine unit. And then underneath there, you can put brief bullets of what your responsibilities might be. So you could put, my responsibilities would be to care for a patient assignment of 4 to 5 and include these skills. And then that's what you're sort of looking at. Where it's difficult is if people we don't look as much at student experiences. We
Right.
want to know what your experiences are as a registered nurse.
Mhm.
So brand new nurses that have just finished nursing school often write all of their clinical
Mhm.
rotations that they've done. That's okay, but where I would look as a manager is like, where's your current workplace?
Mhm.
What are those what are the skills that you do there?
Mhm.
And that your resume is very clear on that. So sometimes people don't put their work experience very clearly.
Right.
And then, if you're an external applicant,
Mhm.
that might be one way that I might not look at you as somebody who has a very nicely laid out resume
Right.
that gives me a very clear indication of what you are as a professional. Where did
Right.
you go to school? What were your last places of employment?
Okay.
What were the units and what was the skill set that you had
Okay.
from there?
So literally just pinpoint the key factors, key responsibilities that you have taken as a nurse when you're working.
Yeah.
So when it comes to experience, there's so many nurses that have experience in, say, tertiary hospital, experience in only like in clinic, like a walk-in clinic, or like PCH, personal care home, right?
Yes.
So when you look at those key outlined skills that applicants have, does it really matter where your work experience is from?
It does. I think it does.
Mm-hmm.
I think if you were coming to, and again, we're critical care, so critical care is a little unique. You have to have had critical care experience to even be considered in critical care. But if I think about more general opportunities to come in, and that might be an inpatient unit, if you worked in a clinic, were you able to manage and organize care for 4 to 6 patients? Could you do assessments, documentation? Are you able to prioritize? Are you able to critically think? Are you able to escalate concerns through the proper escalation protocols of a facility? Because if you worked in a clinic and you only saw one patient at a time,
Right.
settled them into a room, did a set of vitals,
Right.
that skill is not transferable to an inpatient unit.
Right.
You would need a lot of orientation, a lot of onboarding that somebody may not want to offer.
Right.
So you really have to think about the environment and your skill set and what's expected of you where you're coming. And that's where sometimes the research would be key to look at. What are you applying to? And is the skill set that you have going to be transferable to the environment of the unit you're considering?
Okay, I see. Because when you're working in the clinic, it's limited. The skills are limited.
They are.
Critical thinking is limited.
It
Pretty
is.
much, right?
Yeah. And it's a very controlled environment. Patients are walking in to their appointments, so they're always very stable. They're not coming in with an acute concern of an illness, along with 4, 5, 6 other of your patients who are also there.
Right.
So time management is key.
Also key.
So you have to really look at what is it that your skill set is currently, what is it the unit that you're applying to, and what is demanded of you. And that's where a little bit of research yourself. Because if you're coming from clinic and you don't want to be in an area that's 4 to 6 patients, heavy care, total care, and fast turnover, maybe that's not the right place for you to apply. Maybe you need to be looking a little closer to where you're applying to something that might either your skill set or where your future intention is as well. And how are you going to get there? Are there things that that you need to work on to get to there?
Right. It's because I think that may also limit the possibility of getting a job as a nurse applying from overseas. It's because that many clinics in Manitoba or any other places, clinics in Canada would not really consider accepting applicants from overseas because there's so many applicants in Canada already, right?
You're right.
Okay.
You're right.
So you're saying basically just review skills you have and then look at the jobs if that meets the
job description. Really,
the
you
job
have to look.
description. Yes.
Because sometimes it's hard in some of our our online job board or where you apply, unfortunately, sometimes the description, the heading description is very vague. I get lots of nurses without critical care that apply to critical care jobs because they see, oh, it's a nurse position in a unit.
Right.
And then they don't realize through the job description,
they don't really look at the job description.
The critical care is a requirement. And so those, by default, when I look at a resume and I see that there's no critical care, those ones I automatically forward to our HR department and say, perhaps follow up with this person, see where their skill set might be better suited to.
So then, because you're in ICU, what if you're a ward manager? Would you consider them?
I might. Here in our site and in our region, what happens is that internal applicants are obviously considered first. So if there's no internal applicant and now you're what's considered an external applicant, you need to sort of give me something on your resume that even makes me interested in reaching out to you. So if it's poorly written, I can't get a sense of what your skills are, what your experience are, I probably, unless I'm somebody who has a high vacancy and I think, oh, maybe I should look at them, or today's a busy day and I'm just going to pass you over.
Right.
So you need to sort of sell yourself and give me something that would appeal to me. So a nice, like I say, nicely clean, well-written. Your resume should really never exceed 2 pages.
Okay.
Including
the cover page?
Cover pages would be separate. Don't reiterate what's on your resume. That is your opportunity to sort of write me something that says,
introduction.
Hey, I'm here I am. I'm a skilled clinician in what have you, and here's some of my skill set. Please review. You'll see by my resume that I have the skill set you're looking from the job description. I look forward to hearing from you. And then that resume should be no more than 2 pages.
Okay.
And again, if something is from 15 years ago, is it really relevant to the resume? You should be really looking at what are those last 4 or 5 years. Even if you've been nursing for 15 years, where have you been the last 4 or 5 years? If something was 15 years ago and you worked in a acute medicine, but your last 5 years has been as a clinic nurse, right?
Not really.
Yeah, it's not relevant again. Be mindful, right? Because if you're 10 years away from a hospital, that's a very long time.
You literally lose everything.
You do. Yeah, you do, right?